6, Dr. Rajivan Samuel Ponras.
Good morning to one and all, and I want to thank AIOS for having given me this opportunity. So this study is about the DigiRope calculator. In order to validate this calculator, which has already been done in developed countries. So it is an online individualized predicted system of a 95% confidence interval. It is a site-threatening ROP in order to determine the site-threatening ROP requiring treatment. So it is done by, it was actually incorporated and done by the Swedish group in the Sahlgrenska Center. And a study has already been done previously by Pivdoc et al. And he used the risk factors, namely gestational age, the birth weight, and the gender, male, female. So it's an online accessible calculator. Anybody can access it online. 513 premature infants were prospectively examined. It is a study period between June 2020 and May 2022. The inclusion criteria is inclusive of premature infants born between 24 to 30 weeks of gestation and birth characteristics of gestation age, birth weight, and gender. Exclusion criteria have excluded all the missing and incomplete data and like other high-risk factors and congenital anomalies and other eye diseases apart from ROP. The study sample is out of 513 infants. 164 were selected for the study based on inclusion criteria, and the gender distribution was 74 is to 90 girls. So this DigiRope birth calculator incorporates gestational age, birth weight, and gender. So these are the tables which show the birth weight, the gestational age. Sorry for the clarity is not very good. Yeah. So the standard deviation is 2641 here, and it's 1.83 over here for gestation age. 84 were among the ROP babies, the premature babies who didn't need treatment, and needed treatment were 80. The ROC curve is the predictive ability with it had a lesser satisfactory result of an area under curve of 0.718 in comparison to previously reported. So previous reported studies show that the percentage was at least above an average of 90%, but this study doesn't reach to that standard. It is coming to around 0.718. The sensitivity of the study was 90%. The specificity was 53.6% in comparison with Pivdoc and et al. Study in Sweden of 96% and 50% respectively. The results here, it is unusually the males were shown to have a higher prediction for ROP treatment in the future compared to males for the reasons of because of hormonal imbalances and also because of certain pro-inflammatory cytokines factors. The sensitivity is 90% and the specificity was 53.6%. Here again, this table actually denotes will depict where the males actually they have a higher prediction of for needing ROP treatment in the future. The discussion, the global impact, ROP is a leading cause of childhood blindness globally. The risk factors are predominantly are low birth weight and smaller gestational age. So the birth weight, the DigiRope birth model is an easy to use validated calculator and aids in identifying the high risk premature infants who need increased eye examination. So the study insights is that the area under curve is 0.718% and nearly 48.7% of selected babies needed to show treatment. The gender influence, the males predominated in the study. So in conclusion, the treatment related ROP sensitivity and the area under curve prediction were less satisfactory in comparison with the other studies done in developed countries. The model validated for ROP babies with younger gestational ages included those up to 24 weeks and extremely low birth weight infants. This study also confirms that the male genders had a higher significant risk factor in influencing the treatment related requiring ROP predictions. This study also emphasizes the need for even the postnatal risk factors, which could also enhance the treatment requiring ROP efficacy, and this suggests potential modifications to the DigiRope bird model in the future. Thank you. Thank you, madam.
Thank you, Dr. Rajvin. So there are now artificial intelligence used for ROP screening.
Yes, madam.
So DigiROP is only taking into consideration 3 characteristics of
Exactly,
the baby,
yes,
right?
madam. Yes, madam.
So do you feel you can use it on a larger basis?
There is actually another a modified version of the DigiRo, but because I actually this study I only could get the parameters of birth weight and gestational age in this study for among the 500 and the 164 babies. So I was able to confine to the DigiRo bird model. There is another type of DigiRo model actually. I forget the name actually. It is a modified version, but that even included other postnatal factors.
Yeah.
Like the neonatal jaundice and other additional factors at postnatal. So those things had to be incorporated. Since I didn't have those risk factors, I could only confine to the DigiRo bird model. There are ongoing researches like this in the future. So this study actually inspired me, and I thought I have to bring it here to
Because
our
we need to
conference.
have a good sensitivity.
Yes, exactly. Probably my study sample was a little less actually. Probably if I had taken a long period,
Lo-
probably I could
Larger sample.
validate it a little better.
Okay, thank